Imagine a vibrant discussion between people that includes both openness and critical thought in the pursuit of truth. The Purchasing Truth podcast is an experience, a journey, an exploration of the impact that negative messages in politics and the media have on our families, community, society, and nation. Join your hosts, Bill Stierle and Tom Hazard, to discover new concepts and language strategies that will reveal effective ways of establishing truth. This podcast series will tackle current events, leadership challenges, healthcare confusion, integrity in business, and many other areas that affect us all. Gain clarity and understanding of the various truth perspectives. Welcome to Purchasing Truth.
Hey everyone, welcome back to Purchasing Truth. I'm Tom Hazard, along with your host, Bill Stierle. And Bill, I think, boy, this has been a wonderful holiday season in that, you know, everybody gets to take a break and all that, although a lot of us are not traveling to see our family. And it's occurring to me, at least I'm seeing it. I don't know how much you're seeing it, but I'm really shocked how I still come across people that are denying the virus is real, people that are calling it a hoax.
Yeah, it's very, very sad and disheartening to watch the hoax, and it's not going to affect me, and the mindset that sets those kinds of beliefs up. Yeah.
It's shocking to me, and maybe it shouldn't be, but I mean, we haven't traveled to be with family this season. I always go skiing in Colorado every year, and I'm not doing it.
Right.
And, you know, I know lots of other people that aren't traveling, but then I still meet people that are traveling as normal. And the reports are saying that more people have actually traveled for Christmas than traveled for Thanksgiving this year. And I keep hearing about personal accounts of people I know that were, you know, COVID deniers, thought it was a hoax, wasn't as bad as everybody says it is, and then they get it. And then their tune completely changes after they get it and experience it.
Right.
And I keep wondering, what's it gonna take for people to take this seriously? I really don't know at this point, because you would think after 300,000 Americans dying and all the hardship our economy has been through this year and the real suffering people have. I mean, you know what, a little just interesting anecdote. I had to take my wife for, you know, a normal, you know, kind of blood test type of thing to the lab recently. And we drove to the lab and there's this absolute crazy traffic jam. And I'm like, oh no, I hope they're not doing COVID testing at the same facility where we're going to get your blood drawn. And in fact, they weren't, but across the street was a food drive. And there were literally thousands of cars lined up, parked, going around the block, crossing a bridge over a freeway and all sorts of stuff that I had to drive around. And it wasn't the end of the world. I was able to do it. But to me, the visual impact of all those people in need for food, for, you know, people that are food insecure, that are waiting in their cars in a drive-through food drive line to open their trunk and have, you know, a box of 40 pounds of food for each family or each car put into their car. It's like, wow. I mean, it just really emphasized the impact of how things are very different in America right now.
That's right. That's right. It's disheartening about the food stuff. So the ability to apply language, because, you know, this being a communication show, is we speak authentically about that we feel shocked because, you know, our need to care for each other as a nation isn't being met. And we feel surprised because our need for awareness wasn't met about the depth of the virus on other people, on the economy, and what happens to those other people. This is a part of breaking ourselves from the spell of the flat earth mindset. Because you don't see it, it's not happening. But here you are faced with it and you saw it. It's one thing if they talk about food insecurity on the news and they show a picture of lines of cars. It's another thing if you drive by it or you're impacted by it and you're going like, whoa, what's happening here? And now your body deepens to the experience, the human experience or the American experience of food insecurity because you're watching it in real time. Your molecules of emotion now have a truth anchor that then activates natural compassion and empathy because you're seeing it in real time. Now, when we see things on the news, we know it's a snapshot, but it doesn't really fully, it only deepens, it only creates an imprint on us, a temporary imprint. So if we have an experience of violence happening in another country, our brain will say, I'm not traveling to that entire country because I saw that one image. Well, the inverse is also true, is if I see the picture of a food line in Texas, well, it's not happening in California because that's in Texas. And that's a bunch of, our brain selectively plays with truth and frames truth only on what we see in our reality instead of just going like, wait a minute, let's find out what the truth is because there is, and let's find out what the impact is. No, the brain wants to select its own reality or its own illusion. And we've got to remember to speak compassionately about that experience, whether it's on the news or in real time, because otherwise we won't even feel it at all. Our brain will discard it and go like, yeah, boy, it must really stink to be in Texas with all those food lines, you know? And meanwhile, you know, I think there might be a few in California that I'm not seeing or looking at just because I'm not driving by it, or it's not on the news, or it's not in front of me.
Yeah, that's really the surprising thing. I mean, before you gain awareness as to the human brain, we really do compartmentalize things pretty well, it seems.
We do.
And, you know, like you said, hey, if I don't see it, it didn't happen. That is the flat earth mindset, right? Unless you're orbiting the earth and see the curvature of the earth when you're down on the ground and the plains of, you know, Texas, Nebraska, wherever, where it's like, whoa, it's pretty darn flat out here. You don't know it. And, you know, the same thing with homelessness, which I'm concerned there's going to be a much bigger crisis with this soon, especially because this, you know, coronavirus aid bill has been held up, which is supposed to extend the moratorium on evictions. Otherwise, January 1st, guess what? Landlords who've had enough, and I'm sure are experiencing their own hardship, not being able to collect rent from people that can't pay it.
Right.
But you're going to have a much bigger homeless population. And I don't know, this is probably another thing that's a flat earth mindset, because unless you see people camped out in tents on bridge overpasses like we have in Los Angeles.
Yep. Yes.
And, you know, we have already had a big problem with that in Los Angeles, quite honestly, before the COVID-19 pandemic. And now it's only gotten even worse. How are you going to control this virus and get people to take a vaccine, you know, if it's available for them or when it's available for them, if you don't know how to reach them? They don't have an address. They don't have a cell phone number. They don't have an email address. I mean, this problem has the possibility to get really out of control here pretty quickly.
Yeah. It is a bit out of control. It is. It doesn't have the level of stability and certainty. And I really appreciate, you know, President-elect Biden saying that, hey, the worst is in front of us. The worst is in front of us. And we need to come together because the worst is in front of us. And, you know, and for him to, you know, currently do messaging that helps us collectively into a place of cooperation and collaboration. And he's not going to get things right all the time. And when he gets something wrong, I'm saying, yeah, we got that one wrong. That wasn't his things. Yes, that was a mistake that was made in that local area. That's not a global mistake. That's not a nationwide mistake, but it is a way that did not take place very well in that location. It's how do you create safety in speaking and in a way that allows us to have an honest discussion about the human beings and human being condition. I mean, perfection is not something that we can attain in the process of trying to figure out a global pandemic in a nation from state to state. Perfection is something that we're not really going for right now. We're going for safety and containment right now. I like to work our way to taking an action to get most people's needs met, but from time to time, we're going to need to run over some people's needs to get there. And you're not going to get the level of freedom you would like that you had before the pandemic, because people are meeting the need for freedom at the expense of safety by going out. Now, notice that message would really work very well for government officials to be saying, it's like, yeah, the need for safety, the need for freedom and choice are very important, and independence are very important for us as Americans, not at the expense of the need for safety and health of others. That's the way we're working this one. And freedom and independence will return soon. The cost we need to pay for that is care for each other, stay at home, care for yourself for a time. That's the way we're doing it. We're going back to the other thing, but we can't get to the other thing unless we go through this thing.
Well, people are not listening, are not, because of this flat earth mindset. People are going about their lives. The reports are that more people have traveled at Christmas time for Christmas and New Year's than traveled during Thanksgiving this year.
Rationalization. Just stop for a moment. And as soon as I put the word rationalization is that I'm rationalizing. It's not going to happen to me. I'm going to wear a mask as I go through this. Other people are flying. I look at all the different excuses I have, by the way. I'm already at 3. You can see I could get to 7 really quick. It's not that big a deal. I'm going to take my chances. Do you see the level of rationalization? I'm already at 5. Any one of these things will cause a person to travel. I have many clients that have either gotten sick from COVID, or even not a client, but a relative of a client passed because they had COVID and they passed. So one of my clients, her cousin passed. Cousin was in the 60s, in her 60s. And here's what happened. She was lucky enough to go to see her cousin after she passed. And as she was outside about ready to go in, there was the firemen and the EMTs, and are they going to try to resuscitate? But she already had not been breathing for like 10 minutes or 15 minutes or so. Would you like us to attempt to resuscitate? And the woman goes, no, I don't think so. It's like, this is the way this person would have liked to have passed. They don't want to, they were in bad condition already. They don't want to, this is an alignment with her wishes, right? But here's the weird part about it. As soon as we as human beings go through it once, we then rationalize ourselves. Well, I've been through this. I'm not going to probably get it. And, everything is good with my world because, well, one person passed and yes. And it's like, wait. No, it's still in the environment. And it's the same problem during the AIDS epidemic that we had in the 80s. And here there were two significant things in my memory that changed us from being compliant to proactive with AIDS. Two things. Rock Hudson and the wife of the Starsky and Hutch guy. Oh my God, I can't remember his name now. It was right in my head and it just left. But it was famous actor dying, Rock Hudson, and famous actor's wife who had passed from a blood transfusion. In other words, it didn't happen because of the person's behavior.
Right.
It happened because the HIV was in the blood system, right? And those two things, the media got a hold of those, and then all of a sudden sex ed stuff showing up, putting condoms on bananas showed up, in the schools. And then it's like, well, what do you mean to put a condom on a banana, to demonstrate, to protect the thing? In other words, there was this whole movement towards we have to do what we can to stop and prevent the spread of AIDS.
It took a long time to get to that point. Definitely there were a lot of flat earth, mindset going on then too about it. But what's shocking to me, Bill, is even with the enormity of what's happening, I mean, we're losing more people than we lost on 9/11 every day.
Right.
We've had more than 300,000 people die this year from COVID-19. And our hospital ICU capacity is pretty much at zero, at least in California it is.
Right.
And we have not seen the peak of this thing from all the Christmas travel. So this is sort of the shocker to me. I mean, it's interesting you put up the excuses, and that's helpful, how people rationalize what they're going to do and, are experiencing their own civil liberties, their own freedoms at the potentially the expense of others. But I mean, I don't know. It's this really, there's a couple things going on right now. It's interesting because right now in our country, you've got the behavior of the average American citizen.
Right.
That so many of them are continuing to live their lives. They're not going to let it impact their lives, and they're going to go about their lives, but then unwittingly spreading it or being exposed to it. And then you've got the country trying to do something in our government to help all the people with this aid package, which they passed, right, trying to get it done before Christmas. And now the president is throwing a huge monkey wrench in that whole works. Yeah. And we're much further away from, getting ahead of this thing than we realized. Right. And it seems to me the whole country from the federal government on down isn't taking it seriously. I mean, I've been saying, I think there needs to be a 9/11 style shutdown of air travel for a period of time.
To get to the 9/11 style, to get to the shutdown, it's the level of urgency, the personal to get a personal empathy to actually land. One of the things that happened with the AIDS epidemic and I looked it up, was Paul Michael Glazer, and his wife was Elizabeth Glazer. She put a face on AIDS that was personal. They brought their family trauma to the front of the issue. I mean, if Tom Hanks and his wife or one of them would have passed or have had the extensive things, this pandemic would be very, 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 very different.
Or let's say if President Trump had actually died of COVID, or somebody like Mitch McConnell had gotten it, or Chuck Schumer and Nancy Pelosi, somebody very visible in this country to die.
Right. That's right. Somebody that can tell the person I remember watching and living through her story of what their family was going through, because they were out in front of it. They put themselves as the face of it. Go, listen, it's in the blood supply. And all of a sudden it just completely depersonalized it. It made it viable for anybody in the nation to get it instantly because it's in the blood supply. It put the pressure on cleaning up the blood supply. Everything from testing to now, what are we going to do with this? It changed it into most people were in a problem-solving activity towards it. There wasn't anybody denying it. There were people getting wiggly about talking about their sexual behaviors and, well, this is a gay disease and that kind of stuff that went with it. But this disease has not yet,
it hasn't had that moment.
It hasn't had that personalization. It's not, oh my gosh, that was one of my favorite people that died.
I mean, to me, one of the things that raised it to another level was Magic Johnson getting AIDS and coming out and retiring. Now, he didn't die, but he was definitely a face to it that, wow, anybody can get this.
He was.
And that helped, but it hasn't really happened. Not somebody close enough in the orbit of the president, even though Herman Cain died of it. He got it shortly after that Oklahoma rally, and ended up dying. But even that wasn't enough.
Not enough.
I mean, what is it? It really makes you wonder, what is it going to take for people to really take it seriously? Because it seems that there's one of the excuses that I think I hear a lot of people say is, well, all these people that are dying, they really have underlying health conditions. They weren't healthy to begin with. It's too easy for them to sort of pass it off as, well, I'm healthy, I'm not going to get it.
I'm healthy, I'm not going to get it. And this kind of, rationalization, and I said it earlier, it's like our brain is going to look why we're the exception. Not. And it's not about the exception. It's not about the exception. And oh, by the way, the lingering effects of this thing has a tremendous incentive to keep you away from it. The lingering part of it is really darn right nasty. The heart problems and the lung problems and the pre-existing conditions, so you can't be insured, experience that, some people that don't have insurance, like, no, I'm sorry, you've had COVID, so you've had pre-existing conditions and we're not going to insure you. It's like, oh my gosh, it's like that's one of the things that's just very, 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 very challenging, in this experience, because it hasn't had the level of personal, traction and the believability that I got to do something about this. I've got to pay attention to this.
Well, so it's very interesting, Bill. So we've got this very real human health catastrophe going on right now,
right?
And varying degrees to which people are taking it seriously or not. And that's not just the citizenry, but even in our government systems as well. You've had the president, tired of it during the campaign. Everybody's just talking about COVID, right? And he was sick of it. What does it mean now that it seems so strange? It's almost like we have whiplash here, where the president who really is not a big supporter of taking the virus seriously. He
Right.
didn't want to keep talking about it. This aid package for it, which he's supposedly in favor of. I mean, Mitch McConnell doesn't bring anything before the Senate that he isn't really fairly certain is going to pass. So here then they have this aid package and the president doesn't sign it, citing that, oh, it was only giving people $600 each. I want them to have $2,000 each. All of a sudden the president is for the little guy. I mean, what does this all really mean? Because it really is hard to understand it.
Yeah. Yeah. The president's need for recognition, acknowledgement. We want to have some empathy for him because he is a person that's predictable in how he pursues his need for recognition, acknowledgement, and respect, his need for being seen, and need for being heard. He really values those things. And those are important needs for people. Even on the stage of his casinos, he used to do it all the time. Hey, I'll give you $2,000. I'll give you $2,000. Hey, you in the red shirt over there. Somebody give him money. He looks like he needs a car. How about a car for him? Now, backstage, this is from secondhand knowledge of backstage. Get Trump off the stage quick before he keeps giving money away, because that's not a part of the plan. We have them here. We already have their money. There's no value in doing that other than the president getting his need for respect and recognition and acknowledgement met, through the event. And regrettably, over the next, we're probably another 20 days out from 25 days out from the inauguration, it's going to be like this. It's going to be where the need for recognition and acknowledgement has to be met for the president on his way out, or he will, throw a tantrum on the other end. So
you're telling me this has nothing to do with the president wanting to give people more money to help them or to help the economy or to prevent people from being evicted or whatever. This is all, I'm not in the news enough, and I need this to be focused on me. So I'm not going to just let this go through quietly.
Yeah. I mean, it's no, he's not. He's going to, the thing he says has to meet his needs. So, for example, if he says, I've sent investigators to Hawaii to look up Barack Obama's birth certificate, and you won't believe what they're reporting back to me, that's the news imprint. Did he ever do that? Michael Cohen says, no, he never did that. He never sent it. He just said it. And he got the news coverage if he did, because there was a belief, a bias, a fallacy that rich people, when they say things, they can do things because they're rich people. So he has enough money to send an private investigator to Hawaii to look into this thing. But did he do it? No, he did not do it. He did not send anybody there. All he did was say it, and the media took it over and gave him press. It put him on the same power level as Barack Obama. I have just as much power as he does because I'm rich, which was the preemptive. Can be a respectful person and run and be the president, just like Barack Obama. But all he's doing is as a master, and how much kind of recognition and respect I give Trump for being a marketer and a brander and a salesperson, because he can sell things that have less value than what people pay for them. So he's selling the name and the recognition because he has associated a certain amount of respect and recognition for his facilities. And People pay for that association and relationship. The voters that voted for him are doing the same thing. They want to be associated with that type of winner. What type of winner? The winner that gets to say what they want and has enough money to back it up. I want to be that person. So I'm going to vote for that person because I can then say I'm loyal to that person. I don't care. I feel really good about a relationship with that person because I would like to be like, I believe that person because they've sold me on it. And this is one of the problems with money and wealth and things like that is that it doesn't always create, once the person has the wealth, create natural generosity. It doesn't necessarily do that, or otherwise we'd have different kinds of evidence of that, but we really don't. So anyway, so the main part about this is we need a turning point, a truth pivot to this is serious. This can affect me. This can really affect my family. I am possibly, all of a sudden, there's certain people around me, and I'm believing and experiencing those stories of loss. So, like I said, over the last week, we lost a client has lost their cousin. Another client lost their mother. My high school history teacher died of COVID.
We have another common friend in the business world who's in the hospital right now fighting for his life for COVID. You saw that, right? Didn't you?
Oh, yeah. Yeah.
So, I mean, it's very, you're seeing it more and more and more. The more this goes on, it's going to impact everybody. The question is, how soon is it going to impact everybody enough that they change their behavior?
Right. My sister's friend, one of my sisters and brother-in-law's friend passed. And the sad part about it, he passed from a place of shock and disbelief because he was a Trump person. So he was going like, I should get better, like the president. No, this is really a hoax. Why? I understand this is a flu.
See, that's unfortunate. I mean, the president and like Chris Christie, who got it, and other people at the high levels of our government are getting privileged access to therapeutics that not everybody gets access to.
Yeah.
And right. that's another story that's not really being talked about much. And unfortunately, it continues to propagate the idea that it's not that bad. Look, all these people got it.
Right.
And they're still here.
Yeah. And the living with AIDS is living with COVID is being experienced with living with AIDS. You know what? That might be a truth pivot right there for the news media on several outlets to do the living with COVID for a really set of scary, truthful stories of here's what I've had to do to live with COVID now. That might provide us a pivot, Tom. See, we need to purchase the truth about how bad it is. And it's not enough to say a 9/11 every day. And I know that's the weirdest thing. My brain is not even getting that because the 9/11, that's easy to see, the building fall down. I'm not seeing the hospital. I'm not watching death over death over death. I'm not watching the slow passing of lives every day like that. Is that, we're, at the 3,000, 4,000 person a day mark almost now. I guess I need to look up the worldometer to see how many per day.
No, I know it's very well in the US. It's over 3,000 a day.
Yeah, it's like yesterday. Yesterday, the new deaths were in the U.S. were, yeah, like 3,000, 4,000 a day or something like that. It's really sad and disheartening. New cases, new deaths. I mean, we're sitting and we're up there. We're getting climbing up to the 400,000, and excuse me. Let's be accurate. 339,000. Oh, 300, about 340,000 deaths
so far.
as of yesterday.
Yeah.
Now, yeah, we're over 340,247 deaths in the U.S. as of today. So we're clearly on track for 500,000 by end of January or end of February for sure.
Wow.
We're going to be at 500,000.
Well, and the fact that our hospital capacity is at capacity, that's only going to have more people die sooner because they're not going to get the care they need. Right. So the death rate's going to accelerate. So, oh my goodness, it just seems that as a nation, and including our president, and not signing this bill so far, and I mean, it seems like nobody is giving this level of seriousness that it needs right now.
Yeah, there needs to be a truth pivot to anchor somebody into the severity piece. Currently, fact is not getting the job done. Now, isn't that the weirdest thing to come out of my mouth? Fact is not getting the job done.
Well, you often say the truth doesn't matter sometimes, right?
No, it doesn't. I have to have an emotional buy-in to the experience where I personalize it and I feel it. So Magic Johnson getting AIDS, I felt it. I like Magic Johnson. The Elizabeth Glazer, I felt that. Rock Hudson, I felt that. President Reagan felt that because that was his friend. Then he pivoted. Reagan pivoted on that because somebody that he loved that was close to him, that it was his buddy. Then he's going like, wait a minute, my buddy? What can we do about this? And then all of a sudden, but it's mostly affecting gays. Yeah, but this is my buddy, and then all of a sudden, Magic Johnson, and then there was enough anchoring and then personal loss and things like that showed up. I mean, that is the disheartening part of that.
Well, we've got personal loss showing up all over the place with 300,000 dead in this country. It's just,
that's right.
It somehow is still, well, honestly, Bill, I think it's a little bit of flat earth mindset and a little bit of the rise of fake news that has really contributed to how people are not taking this seriously. They don't trust the media and the messages that they're hearing.
That's right. And there's enough people that would be willing to watch media that counters truth, because that's something you can purchase. So I want to purchase a message that reinforces my experience. I don't want to purchase a message that's opposite of my experience, because then I have to rethink my belief. I have to personalize. And it's very similar to the last, the AIDS pandemic, epidemic that we experienced too. It was the same thing, which was, unless I experienced it personally, I now have to re-evaluate my beliefs about gay people as human beings. It's like, wait a minute, but it's not. I have to rethink that, and the same thing is happening with it's like, God, I'm going to say this. This is so upsetting to say, to even come out of my mouth, is that our nation, we don't care about certain things. Minorities, gay people, poor. We don't do a great job with people we call other. We don't do a great job with other. Now, the new other, and please try not to get too upset here. It's like, it's so upsetting to say, we really don't care about old people, because you know what? They're not contributing. They're just a drain on society. Look what I just did as I went right down that narrative to say, what happened to respect for elders? Yeah, but they're living longer. And mom, man, I wish she would have died years ago. It's like, or my elderly parent is too much of a drain financially on us. And they're living longer. Now we've got to pay for it, and that's affecting Social Security. And they're not really contributing to society. It's like, oh no. We have to rethink and question our core beliefs about respect for elders. How do we care for elders? How do we honor them through their life and their lifetime? Now, all of a sudden, the pandemic is taking them out of the equation. It's like, well, yeah, now mom's gone. Dad's gone.
I think, Bill, it would be useful coming up soon for us to take a deeper dive into how the idea of fake news has contributed to this.
Yeah, and I think you watched a documentary on that, didn't you, Tom?
I did. It's called After Truth. The After Truth, disinformation and the cost of fake news. And I found it fascinating. I know you haven't seen it yet, but we're going to wait till you've seen it, and then we're going to come and have a discussion about that.
All right. Well, that would be a good place to pick us up, because really truth is that positioning of making something that people can have a buy-in on it. And then I believe it is going to be effective for me, whether it's a product or in dealing with a pandemic or to change a person's behavior. Unless the person has buy-in on it, they ain't going to do it. They've got to buy in. They've got to say, oh my gosh, look how this really affected my life because of this. This is somebody I really loved and cared about, and now they're gone.
Yes. Well, I just hope everybody doesn't have to lose someone they love and care about in order to get to the point where we're going to change our behavior to stomp this thing out. And yeah, the vaccine's coming, and I'm glad it's coming. But if enough people don't take it, we're going to be stuck here for a long time.
I feel sad and worried about those two things. I would like us to return to stability and normalcy. I would like to feel optimistic about hearing stories about collaboration, cooperation, about how people protect themselves or protect others. A reliance on allowing our needs to be met collectively, including food and shelter. If we can get the food and the shelter thing stabilized, I think that people will tend to stay in and not worry as much. And they wouldn't say, well, do I really need to go to work right now? Maybe it's time for me to learn something online, or even the technology piece needs to be increased. Our nation and the people that don't have access to technology, those folks need to get support so they can buy the food they need online, or be able to figure out how to learn some things during this downtime over the next 3 to 6 months. So we have a lot of rethinking and retooling and reworking of our own mindset in dealing with this. That is for sure.
Okay, Bill. Well, thank you. I really appreciate that. And I look forward to having our next discussion about After Truth. And I think our listeners will probably enjoy that as well.
Yeah, that'll be great. All right. Thanks, Tom. Appreciate it.
Thank you for listening to this Purchasing Truth podcast. We trust that you have enjoyed this engaging and thought-provoking conversation. Our hope is that you've received value, found clarity, and broadened your truth perspective in this episode. If you did, leave us a review or visit our website, purchasingtruth.com. Join us again for another informative and content-rich discussion here at the Purchasing Truth Podcast. Don't just accept whatever information comes your way. Join the discussion. Discover your own voice. Purchase your own truth.